How are you?
Hi! Wow!
Oh, wow.
Wow! I feel very underdressed right now. I even managed to put a little bit of lip.
Why are you?
It's not. Dr. Desire, thank you so much for joining me today. Really brilliant. Honestly, thank you so much. I know like you're kind of busy at the moment because like obviously with all the stuff that's going on, and we're going to get right into it because I think it's so important for people to know and understand. I think you might need to pull your I think they can't see you or hear you a little bit.
Oh, what do I need to do?
You might need to put the brightness up a little bit if you can see you a little bit.
Oh, I see. What's it?
Yeah. And that. So yes. Definitely.
Is that
better? Don't worry. We'll work with it. Okay, so can you introduce yourself, your name and what you do? And and then we'll go from there.
So my name is Dr. Desire Onwochei. I'm a consultant anaesthetist. I work at Guy's and St. Thomas's Hospital. And I am actually, I guess, frontline NHS for this whole COVID scenario.
Yeah. Wow. Mad. I'm just, I don't know how you guys are doing it. Like, my heart really goes out to you guys because you guys are, you're doing some amazing work. I think there might be a little bit of feedback just before we go.
Okay. Is that a bit better?
I think so, yeah. We'll try, we'll make it work somehow. Any problems, we'll try and fix it. But, okay, so you're pretty much frontline, crazy. So when this first started, like, were you guys prepared for what was about to happen at all? Like, were there any notices to say, like, okay, this is what the UK is about to be facing, we need to start getting prepared? Was there any preparation, at least, for you at all?
I think in my hospital in particular, we had quite a bit of preparation. I wouldn't say we had a lot of time to prep, but we prepped probably from the end of January. And our services, how to make sure we had more intensive care beds, how to change our working patterns, get training done, things like that. So I think we were probably a bit quicker off the ball compared to other trusts.
Okay.
So I did feel a lot more confident about that in terms of our work.
Okay. And just before we go further, I know that at the moment, because where the hospital that you actually work for, which is Guy and St. Thomas Hospital, which is pretty iconic in itself anyway, this is fantastic. And obviously we know that the PM is there at the moment. What's the general consensus? What's the feeling like there at the moment? Like, you know, is there like heightened security? Is there tension? Like, how is it there at the moment?
Yeah, there's definitely heightened security. As most hospitals are doing now, no visitors are allowed anyway because of coronavirus, but you can't just come into the hospital without ID. And obviously there's armed police around as well. But basically, I'm not actually supposed to talk so much about that. I'm under strict instruction. I'm not allowed to. But, you know, we are, you know, hoping for the best for him. And, you know, I'm sure as you guys have seen on the news as well, he's doing great. So we keep on hoping that it continues that way.
Yeah, definitely. Okay, so now there was a huge thing about, you know, obviously you were prepared and everything like that, but one of the biggest things was the protective clothing for you guys, because obviously you're frontline, you guys need to be protected from those who are going to be coming in. Was that one of the biggest worries for you, like, or what was the main worry for you in terms of when this whole thing started? Because, like, I think if I was in your position, a whole load of stuff would just been like, oh my God, what do I do? So what was that whole protective clothing thing like?
Yeah, it was a big issue in the beginning, mainly because people weren't sure exactly what level of protection was needed. And there was some confusion as to what was appropriate and what wasn't. But again, we had quite a lot of training, and because we had started planning towards the end of January, there was more time for us to sort it out before we actually started dealing with these patients. My job as an anaesthetist is to intubate patients. So basically that means I put them to sleep, I put a breathing tube down into their windpipe and put them on a ventilator. And that is what we call a high-risk procedure. So there's certain level of equipment, personal protective equipment that I need that other people won't need. But my hospital, again, was great at providing that. So we actually have the same kind of mask that they use for Ebola patients. We have ourselves and visors as well. So I do feel quite protected. In the beginning, it was a bit iffy, but we've sorted it out now, and things are definitely good.
All right. You have obviously, you talked about the whole protective gear thing, that for you guys. I mean, like, with your job, like you said, because you've got to intubate, like, the patients, which I guess is a sort of scary kind of process. How has there ever been a case where, like, you've ever felt like, oh my gosh, like, I don't know if I can do this, or is it that you train so well that every time that you do it, it's fine? Like, I can do this now. Like, how is that? Because obviously now it's in a completely different environment. Like, you literally have someone who has an infection, and you're like, So how is that process for you?
To be honest with you, I haven't felt vulnerable. I've always felt quite protected. And again, I know I keep on saying my hospital is so great, and I'm not biased, it is really great. They've actually done so much for us, so I've never felt vulnerable. In the beginning, when we were doing our first few simulations, what we had to do was basically learn how to take the equipment off as well, because what a lot of people don't realise is that it's actually not just about the protective equipment you have, it's also how you take it off. If you don't take it off correctly, you can end up contaminating yourself. So we actually ran through loads of scenarios of how to take it off properly so that we wouldn't contaminate ourselves, basically. And that is probably one of the most important things that many people don't realise. So with all the training that we had around that, I actually felt quite confident about it. The other thing I would say is that there's always a certain level of protection that you afford yourself when you know that a patient has an infection. So if you don't know someone has an infection, you're probably not going to be as careful. But because we know these patients have infections, we're very meticulous. We have a buddy system, so we check ourselves, we check each other. We always wash our hands. We always, use alcohol gel. We are very, very meticulous. So actually, the chances of us catching something from a patient is a lot lower because of how meticulous we are with the knowledge that they are infected.
Okay. So have you or any of your colleagues been tested at all?
Yeah, so I actually had to have a test myself because I developed symptoms last week. Don't look shocked. But I don't believe I caught it from a patient. I actually caught it from a colleague. So one of the main issues that we have is obviously staffing in the NHS is affected when people go off sick. So a lot of colleagues kind of feel guilty going off sick if they don't feel well. So this particular colleague came into work, trying to be helpful, but obviously passed it on to me. Thankfully, though, I wasn't too unwell. I just had a fever for a day. I stayed off work for 7 days. I managed to get a test. My test came back negative. But what a lot of people, what a lot of people don't know is that actually the tests have a 30% false negative rate. So even if your test comes back negative, correct, it's not 100% guaranteed that you are negative. So there is a bit of debate about how, what's the point basically of doing the test, especially if you're staff. So really we have to go by symptoms. So if you're feeling well enough after 7 days and you've had no fever for 48 hours, then you can return to work. Whereas if someone in your household is having symptoms, then you have to be off for 14 days because there is a 14-day, what we call an incubation period, whereby you might develop symptoms within those 14 days. You might be infectious in those 14 days before you show symptoms. So I think the main kind of thing that we're focusing on now is the development of an antibody test, which will be like a blood test where they can tell if you develop antibodies to the coronavirus and therefore whether you're immune or not. And that's probably going to be a lot more valuable than the current tests, which are throat swabs and nasal swabs that we're doing.
Yeah. Wow, before we go on, it says, Angel asked, so do you think you had it despite the fact that your test came back negative?
Yeah, I do. I do think I had it. Based on the symptoms that my colleague had, which were classical, and I know I definitely caught it from her, I do think I had coronavirus. I wouldn't say that it was the worst feeling in the world. It was just like I felt like I had a really bad cold and I needed a few days in bed. But at the same time, I do have to be realistic, and it might be the fact that I just hope I had it so I can say I'm immune and I don't need to worry anymore. But definitely, I think because there are loads of people out there who are vulnerable, not everyone is going to have a great immune system. People need to stay at home, stop the spread, and make sure that we don't, infect people who are not as robust as we are, potentially.
Yeah. So we know, the news has been reporting that a lot of deaths, the high death rate is in those who are over a certain age and have underlying issues. But obviously now it's flipping because it could be anybody right now. So do you think that someone who's of good health, okay, like in their 30s or 40s, but with a weakened immune system, can they be susceptible to it?
Yeah. Anyone can be susceptible. I think we have to look at this in terms of numbers. So what we are seeing is because we have large numbers of people infected, I think we're approaching 1 million globally now infected with coronavirus. So if you look at the mortality for coronavirus, at the moment it stands between 3 and 4%. If you have 1 million people infected, you're going to have 30 to 40,000 who die from it. Now, the people that die are more likely to be older, vulnerable, have medical problems. But it doesn't mean that people who are young without medical problems can't die from it. But the probability of someone dying from it who doesn't have medical problems and is young is a lot lower than someone who is older with medical problems. So it's all a balance of probability. So we're not saying it's impossible, but they stand a better chance than someone who is vulnerable. We're seeing even of the young patients that we're admitting to our hospital who end up on a ventilator, the majority of those are going home, getting off the ventilator and going home. Whereas the majority of older people with medical problems going on the ventilator are not going home. They're the ones dying. So it's all about probabilities. Nothing is impossible, obviously, but you stand a better chance if you're young, fit and well.
Yeah. So why do you think it's not been reported about those who are actually making it out? Like, why aren't they? Why do you think they're not reporting the numbers? Is it that they just want to focus on the death? Because I know that a lot of people are pulling through, but they really aren't.
They're not focusing on it. Yeah. And I think the media obviously has a big part to play in scaremongering. But at the same time, I think if the media didn't show the sad stories, maybe people wouldn't take it as seriously. If people just thought that, everyone's bouncing back, everyone's fine, then people aren't going to do the social distancing, they're not going to do the self-isolation, they're not going to take it seriously. And the reason why we need people to take it seriously is so that the NHS isn't overloaded with loads of sick people all at one time. Because, as I said, just because of the sheer numbers of people becoming infected, you're going to have a higher number of people needing hospital all at the same time. So that's what we don't want, because the system is already stretched. So we're trying to kind of limit the spread and therefore reduce the chance of us being overwhelmed, basically.
So do you think the NHS needs to now focus on a way where they can handle such epidemics like this again? Because obviously when every health system, whatever system it is only built for a certain amount of number at any one time, or over the course of however many days, not that many days, but now everybody all at once. So do you think they need to now restructure and change? Okay, we need to do things in a different way. We need to start we need to be working for a bigger number of people rather than a smaller number of people.
Yeah, definitely. And we can only do what our resources will allow us to do. But as you have seen, we have been kind of thinking more on a global scale. So, for example, the NHS Nightingale Hospital that has a capacity for 4,000 people, that's a way of kind of increasing our resources to manage the epidemic. We've actually received a lot more ventilators now in order to cope with the amount of people that might need to be on them. I can say from my institution, we normally have a capacity of 60 who can be ventilated at one time in a hospital, but we have plans to expand to over 300 if we need to in certain phases. So plans are in motion to kind of improve things and to increase the resources. We have been quite fortunate so far in that we have not reached our full capacity in my institution, but I know in a lot of hospitals they have. So there are plans now to kind of try and spread the load. So we'll be taking some cases from other hospitals to try and offload them to kind of help each other out, basically.
Yeah, definitely. We've got a question for you from Nisa. She says, being on the front line, do you think, let's see, oops, let me just get that back again. Says, do you think being on the front, I can't even find it. Where's the question? It keeps moving. Okay, being on the front line, do you think that the curve is flattening or that it will get worse before it gets better?
So we have two models that we're working with. One is the kind of exponential model where you kind of see cases doubling every day, which is what Italy was seeing. Or you have the linear model where you'll see a gradual increase over time. And 2 weeks ago, we thought we were on the exponential part of that curve, but it seems like we're more towards the linear part of that curve, where the number of cases that we're seeing isn't doubling every day. It is steadily rising, but definitely not towards the Italy numbers. A variety of reasons could be the reason for that. It could be because people are now social distancing and therefore we're reducing the number of infections. But it will be really hard to tell, and the next kind of couple of weeks are critical to see if our social distancing measures have actually improved things. If we stay on the flatter part of the curve. The problem is if we relax the measures too soon, we could end up moving from the flat part of the curve to the exponential growth part of the curve, and therefore all of our efforts would have been in vain. And I think it's really difficult knowing when the right time is. So I think the government does have a bit of a tricky task on their hands to decide when the right time is. A lot of their kind of strategies based on mathematical models, and a mathematical model is just that. It's just a model. It's never going to be 100% perfect. We're never going to know whether or not this is actually what's going to play out in real life. All we can do is kind of try and predict as best we can.
So you think that the government should extend quarantine period just for the sake of like saving lives and, you know, flattening that curve? Because the most important
definitely, most definitely. I know it's difficult for everyone, you know, isolating and you know, social distancing, but there is method to it, and it is important that we stick to it. And the more we stick to it, the shorter the duration of time will be that we have to do it for. So I think it is really important that people do listen, do stick to the advice, do stay at home. I know it's hard. I'm finding it hard, you know, really hard. But I know the importance of it, and many people do. And I'm hoping that the minor few who are out there sunbathing will heed the warnings and kind of join the rest of us and help save society.
I think anybody found sunbathing should be fined. Like, you actually should be fined. And I think obviously the government is giving police the power to be able to do so. I think you should be fined. Like, what are you doing outside? Seriously, like anybody sunbathing should be fined.
Yes. I mean, I agree, and I think they have instituted some measures and given the police more powers to do that. I think it can be a bit difficult though as a police officer trying to decide who's out for good reason and who's not. But you know, that's actually not my job to decide. But yeah, there are fines that can be levied if people are blatantly not sticking to the rules.
Yeah, definitely. Now, you mentioned earlier on about, some of your colleagues feeling bad for being off sick because they're not able to help where they want to help. Has that been the case for you? And how have you, how did it really make you feel? And how did you deal with it and overcome that? Because, it must be hard.
Yeah, it was actually really hard for me. I did feel very guilty actually being off work. Number one, I guess in our training as doctors, I don't know what it is, there's something ingrained in us that our health takes a back seat. We take a back seat to patient care. So often we'll go to work even if we're not feeling 100%, even if we have a cold, even if, we're feeling feverish, we might just go to work just because we want to help, we want to be helpful. But obviously we have to balance that with the risk of causing harm to others by passing on an infection. So in this scenario, because this is such a rampant infection and disease that's going around, we have had to be a lot more strict with ourselves and stick to the self-isolation. So I did isolate for 7 days, but I did feel extremely guilty about it. And I think my colleagues recognised that and made it so that, I felt as relaxed as I could, knowing that there were people who could cover my shifts and things were going to be taken care of. And what we've done is we've built into the system a lot of slack now, whereby we have people who are on reserve in case people go off sick. So, for example, last night I was doing a shift, and tonight I'm on reserve, so that if anyone goes off self-isolating, then I have to go into work. So we've kind of built that into the system now, just so that people don't feel that guilt of going off, and they do themselves that favour of making sure they get better, and also not exposing patients and their colleagues to the risk of them being infected.
Yeah. So are they going to provide any type of therapy for you or any of the nurses after this? Because this is a major, it's such a major task, not even task, just issue, problem, and one that not many nurses have to deal with. I mean, having to deal with so many dead bodies at any one time. I mean, you might be able to deal with it once every 2-3 months, but to see it on a daily basis, that must do something to your mind. So are they going to be offering any kind of help and therapy for any of you at all?
Yeah, and again, picking up my hospital, we actually have a well-being program and a team of psychologists who are around and offer us drop-in sessions on a daily basis. So you can go for a drop-in session if you just want to have a chat. You can request a private session by email, and they'll organise that. We have lots of resilience training. We have people who are doing kind of support networks. We also have a staff supermarket where you can go and you can get food for free. So essentials like milk, pasta, toilet roll. Staff can go there for free and get things they need. There's a dry cleaning service on site, again, all for free. So my trust in particular is doing a lot to support its staff, to support the nurses, the doctors, the allied workers, midwives, everyone. And there's a lot going around by email and via the WhatsApp groups, just so people know what's available, because we all know it's a difficult time, and sometimes it's hard to find an outlet for your emotions. So the trust is doing well to provide that.
Yeah, perfect. So do you think it should really be rolled out across all the trusts, because I think Guy's and Thomas is an iconic hospital in itself anyway. So they're gonna, in terms of levels of service that they give for their staff, doctors and nurses, is going to be But do you think that needs to be rolled out across all the trusts, because everybody is in the same position? Have they done that at all? Do you know?
I'm not aware that that's the case for other trusts, other hospitals. I do have to say, because Guy's and St Thomas's is a big trust and we have a lot of resources, it is slightly easier for us to institute this. We have a charity as well. People donate to our charity. We have loads of volunteers, and I know that not every hospital has that privilege. So it wouldn't be right of me to criticise another trust for not having those resources, just because they don't have the funds or the capacity. But, you know, there are central things that they can access within the NHS that can be helpful. It's just about increasing the awareness so people know that these options are available and there are outlets available to them as well. And we are sharing our resources as well with other hospitals. So a lot of the standard operating procedures that I've been involved with creating for different departments, we've spread that out to other hospitals. We've shared our action cards with them. We've shared our modelling with them, just to help them organise their own system as well and adapt it to their local policy. So we're being very transparent. We're being very helpful. We're trying to support each other. We're taking cases from our local hospitals. We're supporting Lewisham. We're supporting Woolwich. We're trying to be as helpful as we can to one another because we know it's difficult for everyone.
Yeah, definitely. I mean, it sounds like you guys are doing like a great job, and you know, as much yourself and the rest of the other nurses and doctors. How do you feel when you hear one of your own colleagues has passed away because of this? Like, what does that do to you, or you know, affect you how?
It is heartbreaking, to be honest with you. I mean, thankfully, no one close to me, colleague-wise, has passed away. We have had a couple of colleagues sick, but you know, no one intensive care level, thank God. But obviously, when I do hear about other staff in other trusts in other parts of the country, it is quite heartbreaking because I know that not everyone is going to have the same level of protection that we have. I know that not everyone has the same level of knowledge of the virus. We're all still learning. It's all still very new. And a lot of these staff members have given their life in service to the NHS. Some, you know, these doctors have come back out of retirement to help out, knowing that they're in the vulnerable group. So it is quite heartbreaking. And my thoughts and my prayers do go out to their families for that. And it does put things into perspective. A lot of times as doctors, we feel like we're invincible, that we can never be patients. But obviously that realism is hitting hard right now. It does hit home and it does make you think actually life is short and we do need to value each other, not just as doctors but as human beings.
Yeah, definitely. And has this whole situation, like, how has it affected your faith? You know, your relationship with God, because you know this is the time where a lot of Christians are literally battling with their faith, like, oh, why? And you know, how could you do this? Is this your fault? It's a test. I don't know if I can follow you anymore. But for you, how has that affected your faith? Has it grown it? Has it kind of like, you know, made you realize, oh, okay, God, what is this about?
Yeah.
How's that?
I do have to be honest, it has been quite challenging because we're seeing things that, you know, many of us would never expect to see in our lifetime. And obviously things like church, where you'd go to kind of get that support, because church is cancelled, you know, so it has hit home quite a lot. And I do kind of think that, you know, you do start questioning and thinking, why is this happening? God, why are you allowing this to happen? And I think for me personally, it can be difficult because my faith and my medical knowledge often clash, whereby I know, for example, God can heal this person of this illness, but medically it doesn't look like they're going to make it. You know, so that has been a personal challenge for me on many levels. But in order not to kind of make labour the point, I have to take each day as it comes, and you know, pray as much as I can and just ask for clarity as much as I can, and try and have faith, because without faith, there's no hope. It's hopeless, and I have to resolve to the fact that I'm not able to do everything. I'm not Superwoman. You know, the health service is not able to do everything, and if you don't look to a higher power, if you don't look to someone better than you,
hold on, we're about to cut off, but I'm going to come back on again. Hey.
Hello, hi.
Hi. Sorry, this always happens every single. Oh. Wait, what in there? What happened? What happened? Let's go back. Okay.
Hello, can you hear me?
Hello. Got you. Here we go.
Perfect.
Sorry. Every
It's
time,
okay.
you know what? It happens every single day. When it just gets really good, all of a sudden this is like, oh, is it gonna
Oh, it
time
happen all the time.
up? Why? But it's good. At least we can do it and then, spend a little bit more time talking. Okay, guys, if you have any questions, please write your questions now so that I can put them to Desire. So if you've got any questions about any health issues or whatever, or anything that Desire can answer, she'll try and answer it for you. So please get your questions in right now. Okay, cool. So now, because we were just talking about how conflicting this can be with like your line of work and your faith, because you have a lot of doctors who are Christians but they can't like show their faith. They can't kind of like even project it a little bit whatsoever and whatnot. Like, have you ever been in a situation where you're like, God, like, have you ever wanted to pray for someone, but you know that you couldn't, but it was just like, did you like say a prayer in your heart, or did you like kind of go to them afterwards and say, I'm praying for you, I'm just going to say a quick prayer for you, and then leave? And have they ever accepted it?
I think that's about knowing how to read a situation and knowing how to read someone. You'll be surprised the number of people that will say that they don't believe in anything, they don't have faith, they don't believe in God, but when they're ill and vulnerable, they actually do start saying things that would suggest that they think there's a higher power, or they're reaching out to some kind of higher power.
Oh, wow.
So you do have to kind of read the situation. So there have been instances whereby you can see that a patient wants to hear something like that, and they want to know that you're real as well.
Yeah.
Because sometimes when it's just a doctor-patient relationship, it's almost as if there's no emotional connection. You're just treating them like a job. But when you start reaching out and offer words of prayer and have that emotional connection with them, then they feel that someone really cares about them. They don't just see them as another project. They see them as a human being, as a person. And patients do actually appreciate that. And there are times that I've prayed with patients because they've wanted that. They've asked for that. They've seen, for example, I wear a cross. They've seen that, and they reach out and they ask, and they want that. But obviously, you have to read each situation individually, because not everyone is receptive to it. Because sometimes I've just said a prayer for someone in my heart, or when I'm thinking about that person. Definitely. Each situation is different.
Yeah, because you hear so many stories of nurses and doctors losing their jobs because they believe that they wanted to pray for this person, or they had to do this, and it was like, was that discussion used at all? Could you have done it in a different way? Like Christians, we want to profess the faith, we want to do, but then it's like, gotta use a little bit of wisdom, to execute these things and whatnot. So, yeah. Okay, we've got a question for you. So this question, did you have any side effects after having COVID-19 from Heavenly Bay?
As in, did I have any?
Yeah.
Oh, okay. No, I didn't. I was completely fine. Like I said, it felt like I had a bad cold. I had a fever for a day and a half, and then a runny nose and a stuffy nose. And now I feel fine. This was last week, and I'm back to normal. This is assuming that it was COVID. I think it was, but obviously I'm not going to know until I have an antibody test.
Definitely.
Yeah, I feel completely fine.
So is that antibody test going to be available to everybody, or is it only going to be available to those who have had the symptoms, or who have had it? Yeah.
So in the first instance, they'll be using it for people who have symptoms. But I think the main point of it will be to issue it on a national scale, because the more people that you can demonstrate have immunity, the more you can relax all of these distancing measures. So if we show that the majority of the nation has immunity, then we can say, actually, we don't need to social distance, we don't need to self-isolate, we don't need to do all of these things. So that will be the point, is that eventually that will roll out. And it's my understanding the government has purchase millions of these antibody tests in order for that to happen. But at the moment, they're still doing some lab work on it to make sure that it is sensitive and specific, that it actually works, that it actually shows what we want it to show, and that it's safe. So it might not happen within the next few weeks, maybe in a few months' time, I think, is a more realistic time frame.
Sure. Okay, another question. Someone said that they lost their sense of smell for almost 2 weeks after having it, but the fever was only for 2 days. Is that another what's it called, symptom of the virus as well?
So this is a recent thing, actually. Obviously, the main symptoms that the Public Health England and NHS talk about are fever and cough. But the loss of smell and loss of taste, which go hand in hand often, is a new symptom that in the past few weeks actually has come out, especially with the deaths of 2 ENT surgeons in the north of the country. So yes, it is a recognised complication, and we think it's because the virus kind of resides within the nasal passages and affects the sense of smell there. So often that's all that people present with. They don't present with fever or with cough. They just say, I can't smell, I can't taste. And that is a telltale sign that they probably have the infection. There was a campaign, I'm not sure if it's still going, to get that added to the Public Health England list of symptoms of reasons why people should self-isolate. But as far as I know, that hasn't been added. But in the medical profession, we know that that is definitely a symptom. And if someone has that, they should definitely be self-isolating and seeking out a test if they can.
Yeah. And the thing is, not many people are able to, obviously, you can't go to the hospital because, you have it, but you can't go. So at what point is it that someone has to go to the hospital? What's that? The line that comes across.
So I think if someone is having significant breathing problems, they're consistently short of breath, difficulty catching their breath, difficulty maintaining sentences, so having to talk in short sentences, or feeling generally very run down, very unwell, those are the reasons to then go to hospital, because it could mean they need oxygen and further support. And obviously, you as an individual are the best person to know how bad you feel and how awful you feel. The breathing difficulties is the main reason why I would say someone present to hospital.
Wow, gosh, it's scary, man. I mean, the people that have had it, and it's almost like when I'm reading the description, it's like they feel like that's the closest to death that they are going to get to, and it's scary that this could actually, be it kind of thing. Did that ever cross your mind? I know you only have like minor symptoms of it, but did it cross your mind that like, if this gets worse, like this is not the way that I want to go out. Like this is, or is it? Or it's fine because it was.
I was alright. I didn't think like that for me personally. Was never worried about my own health because I know I don't have medical problems. I know I'm fit well, and I have the medical knowledge to know if I'm feeling that bad. But obviously, I know that not everyone will have that confidence. Not everyone has the same level of health. So you do have to be more vigilant, especially if you are in a vulnerable group or in a high risk group. And if you're not sure about anything, you can always call NHS 111. And they can give some more advice if you're not sure whether or not you should go to hospital. But if you have that thought, if you have that concern, best to seek advice than to sit at home.
Yeah. How were your family during all this? I mean, they must have been quite worried when you told them that, you have the symptoms. Like, what were they feeling like? Were they like panicked a little bit? Have any of them had any symptoms at all? Like, and your mum and your dad as well? Like, how have they been in all of this? Especially with you being on the line.
No one else in my family had symptoms, but my mum especially was very concerned, obviously, when she found that I had symptoms, and even when knows I'm working frontline. She insisted that I send her pictures of my PPE, my personal protective equipment, so she can see that I'm adequately protected before she allows me to go to work. She wants to know. So I was under strict instruction in that sense. But yeah, my parents have been keeping their distance from myself and from my sisters, obviously, because they're obviously more vulnerable than we are. But we've been keeping in contact over the phone, and making sure that we check in with each other whenever we can. And, I do stress to them the importance that they keep their distance from other people as well. So they do know the importance of that, and they've been quite sensible with it. They don't even want to see us right now, which is a big deal.
It's okay. Yeah. And wow, awesome. I'm glad, they're okay as well, because, I think that's the thing, especially if you have parents in that bracket that are quite vulnerable and you can't see them, and especially if you have a relationship with them where, you see them all the time, you're always in contact, but then you can't anymore. It's just like, whoa, this is kind of heavy, and whatnot. So, what is your message, your deep message for people, about this whole virus thing? Obviously, because you've slightly had symptoms of it, but you, thank God, you're fine. And you, the person who's on the front line, what are you telling people right now? What is your message to people?
I guess it's the same thing they've been hearing all this time. Stay home, stay home, stay home. Stay home. Even if you are not in a vulnerable group, you can pass it on to someone who's vulnerable. So please stay home. Please support the NHS. Please help us not to reach that critical stage where we can't cope. Please just follow the social distancing rules. And, the more we do it, the sooner it will be over. Please, as much as you can, stay home.
Yeah, definitely. And she also said that if you're sunbathing, that you should be fine. I agree with that as well. So
yes.
You said that earlier on.
Definitely.
So exactly. So yeah, guys, listen. All you've got to do is stay home. If we don't stay home, then this is going for as long as needed, and everything is just going to be its effect on the economy is even going to be even worse. So I guess if we play our part, then things will go back to the way it should be in rapid time. But I guess if people keep flouting the rules and thinking they're above the law, question, do you think that they should invoke the Italy-style lockdown in the UK?
I honestly don't think it's come to that yet. But again, it would very much depend on how people behave in the next couple of weeks. If we're finding that people are becoming very lax and not, following the guidelines, and our infection rates are going up, and things are getting more overwhelming with the NHS, then we might have to take that to the next level. But at the moment, I think we're okay for now.
For now. Yeah. So we're okay for now, guys. But if you like, keep going out. By July, August, your bowl is your. You gotta stop. Honestly, Desire, thank you so much for joining me and just talking about and just being open about everything and how you've been feeling. And actually, there's one thing I should ask. Actually, what would be your advice for coping in this season? Coming from a doctor, what would be your advice for those who are at home quarantining with the kids and health-wise? What would you advise them?
So just try and look after yourself in all aspects. Make sure you're eating well, exercising as much as you can indoors, or going for a walk not too far from your house. Take your vitamin supplements, especially for us Black people. We need that vitamin D, which is important for your immune system, as well as vitamin C. So make sure you're taking all of those supplements. I know it can be difficult for people with kids indoors, but there are loads of activities online that you can try and find for your kids to do. Try and keep them busy. I think we're never going to have this time again, as in time fully uninterrupted, with your family, where you don't have to go to work, you can spend all of that time with your kids. So as frustrating as it can be at times, cherish these moments, because you will never get this amount of quality time ever again. So use it to your full advantage while you can.
Absolutely. Woo! Spoken like a true professional. Of course. But seriously, thank you so much for, just for taking the time out. I know it's not easy for you guys, and you saying what you're saying, and just like the amount of, patients you see on a daily is crazy. And it just shows the sheer amount, you guys are really under the pressure, under the strain. If we do our bit to stay at home, you won't be as much under the strain. So for me, I appreciate you. I appreciate your team. I appreciate all the nurses and doctors, because you guys are amazing. Thank you so much. All those years of studying, you never thought whoa, I didn't think this. I knew I was going to be a doctor, but for it to now come to play like this is crazy. But I really do thank you for taking the time out to do this as well. So I really, really appreciate it a lot. If people want to ask you any questions, anytime, how can they get in touch with you, social media, what platforms are you on that they can contact you?
So I'm at Twitter, Desire Nkechi. I'm also on Instagram, Desire_Nkechi. You can send me messages, ask questions. I'll be happy to answer anything I can.
Definitely. There you go. Yeah, so if you've got any more questions for her, please do just holler at her, and she'll try and help you as much as possible and just give you the right guidance. Because from a doctor who's on the front line, who knows what's happening, then definitely. Well, Desire, I'm going to let you go. Thank you once again. I really, really appreciate it. And I just pray that God continues to protect you and all your colleagues and all the nurses and doctors for all you're doing, because you guys, man, you really are the protectors. You really, really are the protectors. So thank you so much for all that you do and taking the time out as well. I appreciate it.
Thanks for having me.
No worries at all. All right. Take care. Bye.